never been to South Africa before. From what I've heard, it's very, very different to anything we've experienced here. I would imagine if we'd had a really traumatic year, they'd fit it into a week.
It's just an opportunity of a lifetime to go over there. It's going to be strange. It's a bit, you know, you're a bit wary of stuff you've heard. It's going into the unknown.
Things in South Africa will be quite interesting. We'll perhaps see you know, a clutch of gunshot wounds a year. They will see 100 times that number. I'm not in any sense anxious or worried about that. I'm looking forward to observing how things are improving, because I'm sure they are.
Is it a fast stretch of road?
Yes, yes.
Tim Burnett from the London Ambulance Service is in Soweto to learn how the South Africans deal with trauma. He's on shift with advanced life support paramedic Phampe.
We're going to a medical incident.
Or an illness than that.
Exactly. Incident that doesn't involve any domestic injuries. Going inside to see what's happening there. Baba? Bunjani? Okay. Okay. Salala Pezul. Okay, he's got stomach cramps now. He's complaining of stomach cramps. Okay. He's on dialysis. He's a patient who's got who's suffering from kidney failure. He does it himself, yeah. They've got some stuff he puts through this tubing that he's got there. He has to treat himself at home. So usually it goes septic. And then that's when you'd have a patient complaining of abdominal pains. Just 6 liters.
35-year-old Skumbuzo Nkube is on a kidney transplant list. He lives in the township with his wife and 2 children.
I'm just palpating him. He said he's got abdominal pains, but he says it's the whole of the abdomen.
He needs dialysis at least 4 times a day.
This is the stuff he uses.
Yeah, but in this environment, you can't sort of rule out definitely infection because of where we are, and it's a tube going into the stomach. You've got a foreign body going into the stomach, and there's all risks of, you know, water and stuff and dust, and this is just, we're just like in a garage sort of type thing, you know. And people have bigger garages than this. It's just, and they live here quite happily there. And then on top of that, he has to deal with his dialysis.
He has to go to hospital. Yes, he has to go to hospital. He has to be evaluated at the hospital. They also need to check the placement of the tube. Control, Romeo 01. Bro Fred, do you have an ambulance coming this side over?
I've got a problem at the moment. No ambulance.
We haven't got enough ambulances available around, so we have to wait a bit. So which means we just need to be reassuring our patient. Time we have to check in the vital signs, because I'm sure the ambulance will be here in 20, 30 minutes time.
I was last here in the year 1990.
Alistair Wilson is the clinical director of the Accident and Emergency Department at the Royal London Hospital. He's on his way to Johannesburg Hospital in the city centre.
The medicine that they were practicing was absolutely excellent, really first class, and the intensive care and the whole thing was really a very, very sophisticated operation.
The hospital has the only level 1 trauma unit in Africa, and doctors from around the world come here to specialise.
Go to the chest.
Alistair is returning to see some old friends.
Here we are, lovely. Alistair, good to see you.
Jacques Husen is the head of trauma.
Good to see you, Leo. Absolutely superb. How's things? How's life? It hasn't changed much. Actually, last time I was here, it was quiet. It's really good. That's what I like to hear. Fantastic. Show me around. What's happening? Who's doing what and where? Fantastic.
In Soweto, Louis and Tim are standing by for the ambulance.
We're now an hour waiting here for an ambulance. I've run out of oxygen, 2 cylinders. It's not good for the patient.
Gentleman's now wanting to vomit. He's been sick a couple of times.
Good right.
Is he cold?
Yeah, his head is feeling cold. For me, as a paramedic, it's frustrating. It's frustrating to wait long in a cell. And I can go and shout at them until I'm blue in the face, whatever. If there's no ambulances, there's no ambulances.
Over 2 million people live in Soweto, and they are served by 6 ambulances.
We've waited close on an hour now. Can't hear any sirens, can't hear anything. But for us, we've got to keep calm, stay relaxed, reassure the patient, let them know that the ambulance is coming.
Is it here? Okay. Kubaba what's the fella stretcher? Yeah, sharp one amala. Ramarumo same story, ne?
Skumbozo is taken to Soweto's hospital, the Chris Hani Baragwanath.
Hello.
It's mind-blowing, really, to see that people live this way. One tap, toilets, the sanitation problem. I've never seen it before. I've never seen this much poverty in my life, ever.
This is one thing that I live with every day of my life. With adults, it's fine, we understand, but when there's kids...
It's a bit choking, really, but just to see all that in one sort of, just one area.
This is the last one? Yes. Yeah.
Alistair has joined the team on shift in the trauma unit.
He's got a laceration of about 4 centimeters.
Street vendor Washington Mashaba has been beaten with a shambok, a plastic whip.
I'll use this one, it's okay.
He needs blood tests and doesn't like needles.
Jacket on the side.
If you talk to me at the same time, you won't feel it.
Yeah, okay.
How long ago did it happen?
10
o'clock.
Yeah. 12 hours.
Have you passing urine, passing water? Not since it happened.
I didn't get it here. I'm going to try and then let go right. That one's easy. I just go in, get it out, finish.
Actually, it's easy. Tell you, it doesn't take...
That one's much quicker.
As bad as that. Wrist.
Sorry, this one there's a vein overlying it, so...
Like her rocket, no problems. There you go. And that wasn't bad, was it? A decent artery that's sort of... There we go. Oh, was
Finished, Washington.
That was a shambok you did that, wasn't it? A proper one. Big long one. Big long one.
Yeah.
Yeah, they do a lot of damage. But I mean, it's terribly important to realise that the volume of injury here is actually going down. People aren't doing so much damage, even if you got it today. I won't bash it in your shoulder because it's sore. Good to see you, Washington. Okay. Yeah, bye-bye now, all the best.
Bye.
We've got a trade union marching going through the CBD, the truck drivers union. Apparently there's now been another shooting incident related to this march, so it could be a little bit of a hostile situation we're going into.
Leon Fenter is an advanced paramedic in central Johannesburg.
It's no different to England, everyone getting in the way, not knowing how to get out of it.
He's teamed up today with Tim's UK partner, paramedic Martin Bomford. Together, they have 25 years of experience between them.
Fairly well known round here, then.
I'm not going to be that on you. Too well known. This march seems to be turning into a nightmare.
Apparently there is a guy that is in custody. Got him queried, please, sir.
What have you got?
Shot by rubber.
Only one shot by rubber. Okay. Oza, Baba, let's see.
Are we going to come back?
Where were you shot? Yeah. As you can see, this is the damage from a rubber bullet from the SAP ride control unit.
And another one on the arm.
Quite a bit of swelling, etc. And bruising on the arm as well from it, where it just ruptures the skin slightly. Right, okay, now Baba, then they can get you to hospital.
Riot police are authorized to use rubber bullets when crowds get out of control.
It's all very extreme. It seems when something happens here, it seems to sort of like happen to the extreme.
We're going to go down the bit and then we're going to go, okay?
Smashing team spirit amongst you lot.
Yeah, our shift is very tight. We try and keep the spirit up.
It's the only way you can cope with
the trauma.
With
and
the stuff that you're
everything,
dealing with, I would imagine.
As you can see from your house sizes around you, a very upmarket area.
It doesn't, although these houses are expensive, they don't actually entice people to come in and burglar them. Or...
Not really. This most people here have got private security. You can see
fences, yeah.
Electric fencing. The walls are extremely high.
Right, control runway 3. Go ahead with the details.
We're going to a drowning of a 1-year-old child. It's the only dog here, guys. One of those two pouches have got pizza. Just. Oh, there's a nice wheezing present.
1-year-old Ntabiseng Moletsani fell into the swimming pool and was found face down.
Hou op, ou toe.
Ntabiseng's parents work at the house. Her dad, Isaac, pulled her from the water.
Okay, guys, word julle, kom ons vang hierdie baby, ons move off. Ons kry aan die ambo, laat ons begin. This water is relatively warm. Fortunate thing is when they found her, she was still floating on the top, which at this stage we'll classify as a dry drowning. It's not looking very stable at this point in time. That's why I'm opting to rather load and go with her and get her into hospital as soon as we possibly can.
She did seem very eyes sort of fixed and rigid movement to her limbs.
All right, now we're just going to monitor this baby very, very closely. En route to hospital, we have notified the hospital that we're coming in. She's not very responsive or alert at this stage of the game. I'm actually very concerned with this kiddie. She's not doing too well at the present moment at all.
Mum Emily can't bear to watch.
Giving her absolutely 100% oxygen at the moment to see if we can't start restoring a bit of more brain activity. O2 is reg. Sounds like it was just a respiratory arrest. They started artificial ventilation. She started breathing spontaneously again. At this stage, GCS does seem slightly decreased. She's not very responsive, as you can see, falls asleep very easily. Just O2 en route and that's it.
Where's the scene?
But I mean, there's a nice, good, strong cry. The first one we've had since we picked up, which is a good sign. because I'm a parent, those are the type of calls there where you personally get involved. I just like them with a passion.
I hate doing those kind of jobs. They're so emotive and kids are so unpredictable. One minute they look like they're doing okay, and then no matter what you do, they just keep going down and down and down.
Have you noticed how friendly the people are?
Everybody waves.
You know, to us, everybody waves, you know, more especially the kiddies. You know, the kiddies. And then you just give them a little bit of siren. Oh, they love it. They love it.
It's a respect thing as well, isn't it?
Exactly.
Total respect. Exactly. And I'm loving this handshake.
That handshake, yeah. Check that video. Yeah. Can you see? Everyone knows it. We're going to a motor vehicle accident. I didn't get the details. Mostly we get very, very serious ones at that spot. 01-1028. He's a cyclist, this guy. Can you just grab the C-spine for us there?
Just keep your head still, yeah?
What happened, Baba? Did anyone see what happened? Okay, no problem.
16-year-old Sapiwe Matabula was on his way to school when he was knocked off his bike.
It's all precautionary. We don't want anything happening. If there is any damage to his neck,
exactly,
then we want to prevent any more damage being done.
Can you just try and align him? Just keep on grabbing the head.
He cycles the 12-mile journey every day.
Let's go. 1, 2, 3. I'm testing for any obvious fractures or other injuries. Okay, it's fine. It's okay. Let's fill this. Yeah, it's cold. We need to try and warm him up. I'm gonna put up an IV now on this gentleman. Intravenous.
Relax. Come in. Oh, you don't want needles. It's only going to be a small one.
No, don't want Chief. Just for your safety. Yeah, Chief.
He's got a phobia to needles. You know, so he's Baba,
just relax.
Don't move your neck, ne? Don't move your neck, man.
Very sharp scratch. It's done.
Now we're going to put him on a spine board, fully mobilize him and convey him to hospital. We're at Baragwanath Hospital, approaching the casualty. This is Soweto's only hospital. It's covering for a large area.
The Barra is the biggest hospital in the Southern Hemisphere. 9,000 patients are treated in casualty here a month.
Is it still stable? Talking and on. Okay. 1, 2, 3. The cyclist knocked by vehicle is fairly stable. And they're complaining of pain on the pelvic area.
That looks more like a court or a school hall as well, like benches down the side. It's very basic and very. It's an experience coming in here.
I feel that the call went quite well. With Tim here, I mean, he just knew what to do.
God, we're good, eh?
Thanks.
In the last 10 years, Louis has seen huge changes in Soweto. New, affluent suburbs have sprung up. Today, there are 23 millionaires in the township. Louis has lived here all his life.
This is my mom's place. I grew up here.
So this is where you caused trouble when you were a kid, or is it?
This is where I used to cause trouble, exactly, you know. Cause trouble, you know. There's my mom there. Come, let's greet Mommy. Mommy doesn't like cameras. That's my mom.
Say Sabona, Mama.
You say Sabona, Mama? I told them they know Sabona. Yeah, you know. This one is my nephew. Do that. Yeah, that's my nephew, Katleho. Sabona. Mocha. Yes.
Thanks very much.
At Johannesburg Hospital, Alistair is settling into his shift.
Tell me, when I do that, is that painful?
This guy came in yesterday and had a ding on the front of his brain, on the front of his head, and has now deteriorated, so we need to resuscitate him. Okay, resus, I need some hands, please. This guy can move out to Bay 5.
Liam Brannigan is one of the junior doctors on duty.
He can come in, I'm going to go fetch him quickly, okay? Just wait outside first, thanks. We're going to take care of him, yeah. Okay, thanks. Okay, yesterday he had a CT scan, they found a contusion apparently and sent him home. And now he's become progressively more and more combative. Notice I need etomidate, scoline, dormicum and morphine, please. But we need to move, guys, we can't. Hold his legs down, please. Put your hands there and hold tightly.
3 days ago, 17-year-old Enslin Arenze was walking with a friend when a cyclist crashed into him.
Pop that down, let's pop him across quickly.
Enslin's behavior could be caused by a bruise on his brain.
Okay, because we're actually losing here. As soon as we get IV access, we can give him some drugs and put him to sleep. Basil, can we get an extra pair of hands, please, bitch? We're getting one up now. How's it, Dr. Nkusi? Please, this guy's going to be for you. He's a... Are you in there, Baz? What's the story? He was referred in by Alex Clinic yesterday. Had a CT scan here, which showed a frontal contusion, was discharged by neurosurgery. Went home, and I found him when I came out of CT scanner, wrestling with his family in cubicle G, and decided to make him a resus.
Airway looks like a three-man job at the moment. Yes. Okay, hemodynamically, what's happening?
He's got a good rate.
Registrar Ewan Dixon leads the resus team. He's a British doctor who's come here to learn about trauma.
Liam, I realise it's difficult, but do we have a pulse ox?
We did put one on, and he keeps bumping it off. Ventilating now, and then we'll get an urgent CT brain.
Can I just ask what the exact mechanism of injury was originally?
No, a bicycle knocked him, and he fell backward at the back of his head.
Okay.
You got the scan?
That's it.
Since I walked in, we've intubated him, so we now have control of his airway. The priority now is to get a chest X-ray, make sure there's nothing going on there, and then a CT brain as an urgent. What your thoughts are? I don't want to
check his chest.
Yeah.
One, and get him CT'd.
Now with the head.
Are you happy with the line?
It looks good, yeah, Prof.
Perfect. Yeah.
Line is good, tube is good.
Excellent. Good.
Okay.
How long is the CT going to be?
Probably half an hour here.
And how crucial is that when it's a...
Well, obviously there's a progressive pattern of disease here, so we need to, the quicker we find out what that progression is, if it is treatable, the better chance we have of treating him. So we need to do that quickly.
Hang on, he's spitting.
Can we give him 5 and 5, please? Okay, he can go to CT scan and ultrasound now. It's fine. CT scan is unchanged. It shows the same abnormality that it did yesterday, which is basically the frontal portion of his brain has got a bruise on it. And the problem is now he's stuck because we're not sure if the abnormality is the cause for his behavior or if there's another underlying cause. Perhaps he's taken some sort of drug or perhaps he's a known psych patient. We don't really know enough about him to be completely convinced that that CT abnormality is the only reason for his behavior.
There is a sort of kind of trauma spirit where everybody mucks in, everybody does their bit, everybody has a common aim to get the patient stabilised. You know that by having the team there, the consultant presence there, having the whole system working, I tell you, that is so rewarding.
Timmy?
Oh, yes.
I've ordered true African cuisine here. It's called mohodu. Mohodu, it's ox tripe. I'm made to believe that you guys there in London, you put this in cans, it's in canned containers, sell it to dogs.
We do. The dogs love it.
But here we eat it, so I would like you just to try it. And tell me what you think about it.
Okay. Oh.
Just try it.
Man.
It's nice, it's nice.
Okay.
Okay, go for it. I hope you don't throw up, huh? How's this? Delicious, eh?
See, it's not bad.
Not bad, eh?
The flavour is nice. It's just these hairy, tubey things.
There you go. You even went for the second one. What do you think?
Very nice.
Very nice. Thanks. At least Timmy loves it, eh? That's cool.
Louis and Tim are asked to respond to a call in Hillbrow, in the city centre.
As soon as we go into a pedestrian vehicle accident.
Hillbrow is South Africa's most densely populated suburb, packed with migrants from all over Africa.
Hillbrow is notorious for each and every type of incident.
Just getting a different vibe. Just
yes,
that's the feeling that you're getting here than in Soweto.
And in Soweto, you'd get more respect.
Different world here, isn't it?
Oh, wait. Just get. Okay, it's fine.
Baba, what's your name? What's your name? Ronaldo. Right.
Ronaldo was crossing a busy road when a car hit him.
Ronaldo, try and keep your head still, man.
He recently moved to Johannesburg from Angola with his wife.
He's been knocked by a vehicle. He's a bit confused now. For now, he does definitely have head injuries. He's got some abrasions on the face. There's a vehicle that hit him. You can see it. It's more the side impact.
Just relax.
You're not okay.
Listen.
We are helping you.
Right, Ronaldo, just relax.
Ronaldo.
You don't want listen. You don't want to end up in a wheelchair, do you? All right? Let's check you out. Let's check you out.
There's your techies. There's your techies. Relax. We'll keep them for you. Just relax. Your life is far much better than your techies. Just relax, please. Baba.
Yeah.
Oh, man, I can't believe this. No, his shoes. Ronaldo, leave your shoes. I'll personally keep them for you. My name is Louis. Paramedic from Johannesburg EMS, ne? Okay. Remember the name Louis. I'll keep your shoes, eh? Yeah. Okay. Relax. Guys, on my count, they're ready. Okay. 1, 2, 3.
Yep.
Okay. We're going to take you to hospital. They're going to check you out. You are injured, my brother. Oh, man.
Yeah, do not leave me. Your babies. Oh, look.
Pride and joy. All right.
Don't cry, man.
How's the patient? Still stable?
All good.
Okay, that's great. Let's hold this.
Yes.
Baba, I'm gonna be okay handing him over.
Yeah, of course.
Guys?
How are you doing? Okay. This is Ronaldo. Been hit by a moving car. The approximate speed. Do you know what speed he was travelling?
Yeah, approximately like 60 kilometers. That's what
so hit by the car. What we can find, he's got facial injuries, head injury, no loss of consciousness.
Ronaldo, how are you? Good. What's this place?
Hospital.
Good, very good. Do you have any pain in the back here?
Nothing.
Nothing.
Say yes or no.
Yes or no?
Nothing.
Don't move your head.
Yeah?
Say yes or no.
No.
Here?
No.
Nothing. To the side?
Nothing.
Turn it to the other side. Good. Okay, C-spine's
Nothing.
clinically clear. All right. Breathe deeply in and out.
No. Nothing.
I need to listen. Breathe for me. Slowly. All right?
I can go on.
When they're done with you, all right? When they're done checking you, you'll be able to go home. Is that okay?
Today.
Okay. You need to first wait. I'm going to do some x-rays, okay? Just to make sure everything's okay. If those x-rays are right, we can clean you up, see what's going on your face, and send you home.
Okay,
right.
We're going to a collapse incident at Dipkloof, Zone 1. No idea whether is it an adult or maybe a teenager or something. So we'll see as we get there.
Looks like the guy's in cardiac arrest. His heart's not beating, he's not breathing at the moment.
Grandfather of 3, Wellington Stemele, has collapsed at his home in Soweto. His sister found him.
Guy's got no heart rhythm, so at the moment we're doing CPR. If we can get a rhythm, we can shock him.
Where's lower compressor? Hyperventilating.
Yep. So at the moment what we'll do is just hyperventilate, get him a load of air inside his lungs. Louis got a bit of time just to put a tube in.
Let go. Correct pressure. Press it hard. Give me this.
Good now.
Back.
Don't know any medical history, so he just might have been ill for quite a while.
Giving him adrenaline. Adrenaline, 1 milligram, ne?
4. Yeah. Grab this. Got all the family watching us, and they're hoping, so...
You got it again. Another 1 minute. Are you okay, Tim?
Yeah, man.
You want anyone else to help you
fine
out?
at the moment.
Sure.
Yeah, you carry on.
Okay, no, that's cool. Okay, now it's atropine, 1 milligram. Enhances the heart rhythm. Okay, guys, atropine, this is the last one. The last atropine.
Okay. Still pulseless, so just got every stop every now and again, just to check.
Stop. Back. Okay. Give me a second. Okay, no pulse. Okay, it's fine, guys. We've tried to record. Okay, we did do all the necessary precautions we had to do. Used all the research drugs that we have for patients on cardiac arrest.
Louis talking to the family now. He's explained why the gentleman's died, why he thinks, and they're taking it quite well. So he must have been ill for quite some time.
And they just have to do the funeral arrangements. That is to get the undertaker to come and get the patient. With Tim there, he was absolutely outstanding, doing the chest compressions. It's not easy. Let's just put the stuff in Tim and get the car ready for the next shift.
Patrol 01.
So how long have you lived up this way?
6 years.
Did less shootings here than...
We've had, in 6 years, 1 instance in our suburb.
It does strike me that the whoever's causing the trouble tends to stay in their own area, or...?
They stay in their own area because they know the area well, they know where they can hide out, where they'll be safe.
I've not felt unsafe around the areas where we've gone. But I felt less safe getting to the call, not through your driving, but through all these missiles, manned missiles that are out there. You just know there's somebody there that wants to get you.
We've been called out to a shooting incident. Patient's apparently been shot in the chest. Unconscious at this stage. We must just be a little bit cautious going into these buildings in the area we're going to. They are slightly suspect and very poorly lit usually.
The patient is on the 9th floor of a high-rise apartment block in Hillbrow.
There's not going to be a lift, is there?
No. Control Romeo 3. Right, thank you. Located SAP vehicle in the building. We're on our way out.
How do you normally cope with all this equipment on your own? No lifts.
Yeah, it's an absolute disaster. This side. Yeah. How's it, guys?
2 men have been shot. Leon finds 1 man who's been killed.
Did you find the other one downstairs?
No.
So, okay, maybe they...
What was wrong with the other one?
Excuse me?
What was wrong with the other one?
No, he's still alive.
Shot where?
Yeah, on this stomach.
All right.
Yeah.
The other patient has gone missing.
Yeah, there was no one downstairs when we came in.
Okay.
Or no one stopped us, let's put it that way.
Yeah, okay.
Gunshot head. Looks like. Yeah.
He's had 2 of them and the other bloke got 1 in his stomach, didn't he?
Okay. What was the story exactly? So?
No, he said these guys are known to them. You see, there were 4 of them in here.
Yeah.
So they just came in and
started shooting. No reason or anything.
So it's like, looks like it's all grudges or what?
Or something.
Something like that.
All right.
So,
okay, thanks
okay.
much. I'll see you downstairs just now.
Okay, let me go down.
Okay, sure. All right, now I've just got to do the documentation for the police declaration of death to say that we were on scene, have examined the patient, he's definitely dead on arrival. So for their documents and to open a criminal case, they will need this.
Sad waste to lower. But so, you know, what can you do? Unless you're going to change the way people live, you're not going to change what they get up to.
I think that's probably not very much at all.
New Year Nkasi is the other victim of the 9th floor shooting. He's made his own way to Johannesburg Hospital.
Gunshot or stab? Gunshot. Which bed can we use? Three. Alright. Get the chair out. Baba, what's your name? How many bullets did they shoot you with? The arm and the back?
Yes.
Alright. Okay, we're going to help you. Just lie for us. Lie straight on your back.
On your back.
Sister, airway is open, self-maintained. Gunshot wound. 2 gunshots heard by the patient. Can we have a SAT monitor, please?
Blood pressure 150 over 100.
What's our SATs?
BP is 213 over 117.
Yeah, he's got good air entry bilaterally. His abdo is tense and tender with guarding. Can we have someone else to help us with the log roll, please?
Ready for your roll? 3, 2, 1, roll.
Okay. I have a right bullet wound on the lower edge of the costal margin. There's a bullet wound just under the left gluteal fold. It is marked. All right, on his right upper arm, he has 2 bullet wounds.
In the arm, it looks fairly straightforward, where you've got a hole here and a hole here, and it seems reasonable to assume that that's entrance and exit. And the abdomen and pelvis, we're not so sure. It could be 2 separate bullet wounds.
Interesting track, if it's gone from top right to bottom left.
Baba, what we're going to do is we're going to need to take you for an operation because you're probably bleeding in the stomach. All right, that's why you've got the pain.
Okay, Debbie, everything now should be moving towards theatre as quickly as we can, so let's go, okay?
Leon has been called to a difficult job, to certify the death of a 6-month-old baby. Paramedics in South Africa are legally allowed to do this.
The system, the responsibility that Leon's got, an authority, is doing another recognition of death. That is nothing like the system we have. So really, that's an incredible amount of responsibility on your part. How do you determine that that's not malicious mistreatment or poisoning?
That is not up to us to decide that. If I had any suspicion that something didn't look kosher, that there was obvious sign of maltreatment, etc., I would contact the SAP and Child Protection Unit immediately and ask them to come out.
This puts an incredible responsibility on these fellas. I said this is mind-blowing.
Yeah, the weather tonight is cold. So people probably are indoors.
Lou says it's cold, it's 18 degrees outside. I want my shorts on.
It's quite peaceful. And it's totally not what I expected.
I think there's much change, you know, due to the fact that we have police patrolling all over the area. So I must say they are doing their work. There is still crime, but it is on a decline.
It's obviously they're doing something right. You know, you speak to people, oh, you're going to Soweto, oh God, you know, be careful, and blah, blah, blah. You know, I don't feel threatened, I don't feel unsafe, I don't feel anything. I feel quite at ease here. I'm loving it, and it's not anything like I expected at all. It's 1,000,001 times better. Chicken?
Yeah, spicy chicken, yeah.
Come on then, bring it on.
Can I have chicken and chips? Yeah, hot.
Some extra hot spicy chicken, peri-peri chicken. Doesn't think I'll take it, see? Cheers, guys.
Gee, they really made it hot. Huh? We shouldn't be eating this as paramedics. Huh? It's too hot, huh?
No, it's really nice.
No, it's too hot, seriously.
He's going to outnumber Joe. 1,000 to 1.
gunshot chest.
We need some more doorman for slot 2.
I don't remember personally seeing it quite as busy as this for some time, but to have 6, 7 patients in 4 resus bays, most of whom are intubated, 2 of whom are shot, is reasonably busy.
Can we go in there quickly?
Intubated with a size 7.5.
You know, you get like 7 or 8 trauma calls going on at once, and when you've only got enough kit for 4, and you're sharing the monitoring, and you don't know which saturation probe belongs to who, and I mean, it becomes very confusing.
Okay, cool.
Comfort Timmer, father of 5, has multiple gunshot wounds.
Gunshot wound right shoulder, another gunshot wound medial elbow.
Tell me how many gunshots he's got and where they are.
Which is the side of it?
1,
One on the right.
3, 4, 5, 7, 8.
Okay, what's his abdomen like, Nicole?
Both feel soft. Sorry, see?
Which feels like I'm in.
Are you feeling pain there or
Can I just have
tummy?
that?
The tummy, the way you're touching me now. Yeah.
There, you're feeling pain. Sorry, see?
His wife, Nora, is waiting outside.
I'll do a manual now.
Bleeding is the main concern, so the priorities are the same for any trauma patient, to resuscitate and then make a decision about which way we're going, either towards further investigation or to theatre. This man looks like he's going to theatre.
But what happened to you? Who shot you?
I don't know. I couldn't see him on the face, but...
Was it a hijack or what was it?
No, the motive was not a hijack.
What was the motive?
I don't know, because he was not after the car. He just shot at me.
So you were in your car?
Mm-hmm.
And where were you, at a robot or what?
No, in my yard.
In your yard? Okay.
Have we log roll? Can we quickly log roll and check nothing's crossing the midline? Nicole, can you specifically check axilla and in the perineum as well, please?
Nothing in the axilla, all right?
Well, the big problem is she's got such a large distance between A and B, makes it impossible to get a needle that would actually stretch the length of the distance that you require, really. No saw, no go. Can't get it in.
Okay. You feel okay at the moment? Are you comfortable?
My tummy is...
Okay. Has he had analgesia?
No, not yet.
Okay.
Given
his blood pressure at the start, we don't want to give him too much morphine, but 5 morphine now, and then reassess. If he's still sore, he can have more after that.
So should we make him sign the consent?
Now do you know you've been shot all over your...
Yeah.
So now what needs to happen is we need to go to theatre. Because we worry that you've got all your intestines, you know, the bowel. We worry that you've perforated it.
The chances are things have crossed the midline and gone into the abdomen, so we just have to check that out. Even getting into the abdomen in the patient lines can be tricky because they're just so big. So we'll see what happens. And with that number of bullet holes, just has to be done to be safe.
Ewan has to explain to Nora what's going to happen.
He's reasonably stable at the moment, but he's a big man.
Yes.
And he's been shot 7 times. Okay. So our priority just now is to take him into theatre, open up the tummy. Any problems we find, we're trying to fix. And once we finish the operation, I'll come back and speak to you and let you know how we're doing.
Well, wait.
Yeah. Okay.
Thanks, Doctor.
Okay,
Your
no
name is
problem.
Doctor?
Mr. Dixon.
Dixon.
Yeah. Okay, I'll come and speak to you. Okay.
Going to a shooting incident in Mapetla. Someone has been shot on the leg. It's not a very rough area, I know.
It's not known for gun crime that much.
No, it's a fairly quiet area. The guy is shot on the leg. Ambulance was here first. We need to check him out, what's happening. Baba, Baba,
Security guard Glenn Lebalo had finished a night shift when he was mugged from behind and shot.
He's not sure what time is it, or what time was it when he was shot. Seems like he's got a fractured femur, eh?
He's got 2 wounds, one at the top, one at the back. The bullets penetrated through it and just smashed the bone. He could bleed quite bad, and then when the blood's going into the muscles and stuff, it causes him a lot of pain. Checking the pedal pulse on his foot, just for circulation. If there's a pulse, then there's circulation. If there's not, then you would have to give it some traction. Other than that, he'll lose his legs and stuff. So.
No, yep. Just 3 milligrams of morphine. Morphine for pain. Can you ankle strap in? Put the ankle strap. Ankle strap.
So what they're doing now is they put the traction splint on tight, which will give it traction and pull the bone. So if the bone's like that, it will pull it so it's equal, which will allow circulation.
Is it in? Not too much. Then Tim, you can just put it for me. Just put it. Just stand. Don't move. Baba. 1, 2, 3. That's it. Magic. That's it. Okay, let's see.
Now circulation is going around his leg. Now the bone's got to be fixed at the hospital.
This man is a challenge for 2 reasons. Firstly, he's multiple gunshots, which increases the chance of multiple organs being injured inside his abdomen. And the second problem is his size. And technically, it's going to be difficult to operate on him because he's so large.
Well, that's an interesting little finding there.
Isn't it? Yeah.
That's a bullet track which has gone through the fat. So from one side to another, through there and through there. Which is presumably one that we don't need to worry too much about.
And packs, please.
There it goes. Yeah, that's it. There's a hole in the colon here, and that's that sort of dark area here. And another hole which is just tangential in the small bowel, just there. Now, the large bowel is the bit where the feces come just before it comes out. So that's been leaking into the lower part of the abdomen and bleeding as well. I mean, it's a very, very big injury for a very, very big gen, really. So that's the area there, isn't it?
My only concern is have we found everything that there is to find, because he's got so much fat, it's very difficult to tell.
We've been around the whole of the rest of the abdomen, so we know that the liver's okay, the spleen seems to be okay, but everything else seems to be fine, which is great.
Damage to her large bowel means we'll have to resect or remove that portion and then join the two ends back together.
We've done more surgery since he's been here
than I had in the last 8 years. Certainly seen more gunshot abdomens here. To put it in perspective, we had an American professor visiting us, and he said that in order to become a board-certified trauma surgeon in the States, you have to do about 50 trauma laparotomies, which is what we're doing at the moment. And you do those 50 trauma laparotomies over the course of 2 years of a trauma fellowship. I think I'd probably done about 50 trauma laparotomies within about 3 months of arriving. Hopefully he'll do okay, but I think the odds are stacked against him at the moment.
Well done. Very good. Very good. That's nice. For a failure of an operation, I have to say. Very good.
A goodly proportion of tonight's work has been fairly big gunshot wounds. I mean, it opens up your ways of thinking that you sometimes laid dormant. It is very good to have a completely different perspective on trauma. To be able to do trauma medicine in a way that actually makes a big difference, where patients survive as a result of what you do, that's terribly, terribly rewarding. I hate the thought of retiring, because it's a bit of an addiction, I guess. You just have to do it. You have to do it.
Thoroughly enjoyed it. It's been an experience, and it's been of great interest. He's great. He's great. He's a tremendous paramedic, and it's been a pleasure to be out with him. Thank you very, very much for having me over, mate. It's brilliant.
Coming, yeah. It has actually been very, very nice. I've really enjoyed it. I haven't had a partner now for going on 3 years that I've been working alone.
Oh, it's been a complete eye-opener, and I've got to take my hat off to you. You do a brilliant job here, really do.
No, thanks more. I really appreciate hearing that.
This will be the last time I see Soweto, so I'm quite sad, actually. I've learned loads about Soweto, about South Africa. I'm going to miss Louis. I'm gutted that that's it. We're not going to work together anymore. It's just like we really clicked.
Sure, Timmy. So it's the last day.
That's it, man. It's finished. We're done.
Yes. So otherwise, how did you find the whole setup?
Absolutely brilliant. I've loved every single second working here. I've loved every single second working with you, man. It's been...
Really? I mean, I must admit that it's the first time working with someone outside my service. And honestly speaking, having you around, it's like I've been working with you forever.
That's right.
I mean, it was honestly worth it. Okay? Cheers, man.
Let's do it.
Sure.
So you ever thought coming to London?
Yeah,
I'll get you a job.
Man, I would love to.
Comfort survived his attack. He spent 6 weeks in hospital with a private guard. New Year is doing well. Nobody has been charged with his friend's murder. 17-year-old Enslin didn't have a permanent brain injury. He's now back with his family. Before having any treatment, Ronaldo put on his trainers and fled the hospital. He hasn't been seen since. And Louis did make it to London.
That was great, man, eh? It's amazing. I haven't got enough words to even explain this whole experience.
Buckingham Palace. She's in, because the flag's up.
Probably stop for coffee, eh? Give her that, that's already handshake.
Do you reckon she'll do it?